Over the past 3 days, about 300 people have been killed in Pakistan because of scorching heat. Temperatures have hovered above 40 degrees Celsius through the weekend. The worst of the heat is in the southern Sindh province. Making matters worse, the electricity grid crashed, forcing authorities to declare a state of emergency. Heat waves deadlier than before, health conditions like heart attacks more common. A highly anticipated report from one of the world's leading medical journals says climate change could cause all of that and more. It provides some of the most damning evidence to date on the links between climate change and public health. But perhaps just as importantly, it proposes some actions to make it better.
Intense heat waves killing hundreds, even thousands at a time. Air pollution shortening lifespans. And rising sea levels impacting coastal communities. A new report from the British medical journal, The Lancet, documents the impact of climate change on human health and its economic cost. Nick Watts is the Lancet Commission's head of project.
We believe that climate change is the biggest global health threat of the 21st century.
Watts says there are all sorts of medical conditions linked to or made worse by climate change, from asthma to heart attacks.
The report talks about the fact that climate change has the potential to undermine the last half century of gains in development and in global health. This is a really sort of quite concerning thing from a public health perspective. I really don't think the experts and the professionals in the report could be more clear about how concerned we are about the impacts.
The world spends nearly $7 trillion each year on health care. As a percentage of GDP, the United States spends the most, about 17.7%. Watts says air pollution is one of the best examples of how investment in greener technology can lead to savings in the long run.
A swap from, for example, coal-fired power to low-carbon energy sources, the benefits are felt immediately. The benefits are felt within the coming weeks. When air pollution decreases, you see a decreased rate of cardiovascular and respiratory disease, reduced hospital admissions, and as a result, cost savings for the healthcare system.
Fossil fuels, namely oil, coal, and gas, account for more than half of all the world's energy production. Developing countries, including India, support the development of coal energy, saying it's more affordable.
The United States or Europe burned coal and fossil fuel for the last 150 years, kept their energy costs low. On the back of that, they created jobs, they created industry, they created superways, highways, ports, airports, developed their economies to its current levels of economic progress.
It's an argument the study addresses, saying the low cost isn't worth the higher cost of bad health. The study advocates small steps like walking and cycling rather than driving.
The main barrier now is a political barrier. And that's a positive message because it shows that it's technologically and economically feasible. The finance is plentifully available. It's just in the wrong place. It needs political support and strong signals to help shift it.
We should add the United States released its own study Monday saying that by the year 2100, climate change will cause 57,000 deaths every year. It's convening a special meeting at the White House on Tuesday to discuss the links between climate change and health.